Hello, everyone. My name is John Gentile. Here's my final critical assignment on our fitness education presentation that we did for KIN 562. Here we go. So here's the overview of how the presentation is going to go. First, I'm going to go over the health and movement assessment, which included functional movement screening and PAR-Q. Go to the periodization of the programming that I elected to perform and implement with my client. Next is the exercise technique. So I took the two compound movements, one of the upper body extremity, one of the lower body extremity, and broke that down. The video is in that section. Next is the applied integration of how I took the knowledge from this course and how I'm going to apply it to my current status with my current job and my position to future occupational goals and everyday life, and how I can implement and be a better person based off of what I learned with this class. And finally, the last few slides are on the faith integration. There is my references in appendix on some of this stuff. So overall, we're going to go into the health and movement assessment next. So we used the main focus here was the functional movement screening implemented by Greg Cook. It assesses the body, or assesses the individual's fundamental patterns that challenge the body in both stability and mobility. It's a great assessment. It's a great screen. I think it really targets the whole body. Yeah, there are a lot of variables in different tests and assessments out there. I personally think this is the best one to help get those individuals back on track to where they want to be to achieve both their fitness and regular lively goals, to work on just regular functional movement to make sure they're moving safely and efficiently through those patterns. Next, we have the PAR-Q, just as a regular fitness questionnaire that my client performed and filled out. It is a health questionnaire that can provide information to the instructor, which was myself, to see if the client needs any further medical clearance before starting the exercise process, in essence, to see if there's any sort of discrepancies based on obesity, heart, chronic heart disease, and stuff like that, if they need to be cleared. So moving on. The FMS, my client scored a 15. The main dysfunction with my client was the shoulder mobility assessment. He scored a 1 on both sides with drastic limitations. By moving the two fists, he had a great 3 inches plus on both sides. However, no pain occurred, so it was good. He didn't need further evaluation there. The other two asymmetrical movements that caused him trouble were the hurdle step and the inline lunge. A lot of loss of balance there, create a lot of hip tilts, hands coming off his hips, creating a lot of anterior forward tilting, stuff like that. The programming process for my client was to implement more unilateral work to improve his flexibility and mobility within routines, targeting the upper body. We did target some of the lower body with this, but the upper body mobility, really focusing on opening that chest up and making sure there's not a lot of hole, making sure that shoulder girdle is nice and can move nice and sturdy throughout certain patterns without any pain or discomfort. The results of this screen are within the appendix, which I'll show you at the very end of this presentation. The PAR-Q, regarding the questionnaire, my client doesn't have any health risks or concerns for further evaluation. The PAR-Q was able to provide me information that would help me develop the programming needed for my client to achieve his fitness goals. Next, we're moving on to the periodization. My client's main fitness goals is to build lean mass. He wants to be able to lift weights without any pain and become stronger. He's a 50-plus-year-old gentleman. Just wants to be active. He likes to lift weights. He follows CrossFit routines. He enjoys CrossFit. He enjoys lifting. He just wants to be healthy, but also put on lean mass. However, he is slightly overweight, so we are going to target a little bit of aerobic exercise there. And as you can see, we're going to go more of the hypertrophy route, so we can increase muscle mass, lean muscle mass, but also lower his body fat, focusing on high repetitions and short intervals. I developed an undulating or nonlinear periodization program. This program is when the volume and the load changes. It creates a nonlinear workload and training volume. I went with this process because it helps eliminate neural fatigue that is caused by an extended and increased training intensity, common to the linear model, but we're mainly focusing on eliminating that. Exercise selection, we're going to focus on upper body and lower body routines. So one day will be an upper body, next day will be a lower body, followed by 2 days will be a aerobic and mobility stretch day. And the last day will be a active recovery, or some call flush day. We're going to focus more on the push-pull movements, individually having 2 compound movements. So the upper body, we're going to focus on some dumbbell neutral bench press, dumbbell single arm rows, 3-way shoulder raise, etc., multi-joint movements like that. Lower body, we're going to target some back squat, dumbbell step-ups, box jumps, alternating lunges, or alternating jumping lunges, I should say, and so on and so forth. Move there. More on the aerobic side, we're going to do some treadmill runs with some sprints with specific time domains and heart rate intensities. Finally, for his flexibility and mobility routine, there's this program called ROMWOD. It's range of motion workout of the day. He already performs on a regular basis. I didn't want to steer away from him performing that. So it's a website that focuses on stretching routines, similar to yoga, but you're really holding those poses a little longer than how yoga would. More of you're holding these poses for about 2 to 5 minutes, depending on the specific day that you're performing that routine. The exercise order, the order is created, goes from the prime movers, so the main muscle groups, followed by the secondary muscle groups, then followed by core movements. So there are core movements at the end of each day to really work on his core stability and midline strength. I set the order up as a push-pull so my client can recover and recruit different muscle patterns between each exercise. So doing a push, then he's going to perform a pull. So he's going to do his dumbbell bench press, then right into his his pull, so he can create more recovery within that pushing aspect, and then that pull, vice versa. The frequency, intensity, duration, and progressions. So my client, I would label more of an intermediate advanced when it comes to his training history. He's been working out before he was even my client. He just needed more guidance and knowledge. When it came to this, I've been training this individual for about 3+ years before integrating him into this class. He can handle a training volume up to 3 to 6 days with an active recovery day on the 7th day. Programmed within this class, I have a 6-day workout routine, followed by the 7th day, which would be Sunday or whatever he distinguishes as his 7th day, or we determine his 7th day would be a flush active recovery, which is just a long bike ride, about 45 to 60 minutes. And I'll show you that in a sample of my periodization cycle program. The intensity of the workouts and exercises have been designed based off of heart rate and 1 rep max percentages. So all the aerobic exercises are going to be based off of his heart rate, percentage of heart rate. So mostly we're going to be between 75 and 95% of his max heart rate on some of his runs, not his flush run. So this flush active recovery is just very low heart rate, between 40 and 60%. It's very low. It's just get the body moving. With the actual weightlifting and core routine, core routine doesn't really have to follow percentages, more off of RPA, so maybe a rate of perceived exertion. But the weightlifting will be based off of percentages, so between 70 and 80%, and maybe get to 85% towards the end of some of this, the 8-week cycle. He'll be guiding into those higher percentages with those certain repetitions. The duration of each workout should last approximately 45 to 60 minutes. It's what he handles on a daily basis, as is. Really no scientific background behind that. Progressions from week to week will be based on my client's condition and body area. Lower body will be able to progress a little greater, will progress at a greater load than the upper body, just because their ability to recruit more muscles and the lower half is stronger. Making small increases weekly will develop the client's confidence, but also be able to see if the movement patterns are getting better, especially based off of our FMS. Continuing with the progression, with my client having 3 scores of 1 on the FMS, it is a priority to make sure that he is moving correctly through those prescribed exercises. So making sure there's no pain or discomfort going on there, but also that the movement patterns and quality are getting better. Also making sure injury risk is low, but movement quality is high. Here's a little bit of a sample of my periodization, so you can kind of see my percentages here for some of the movements, and then also some of the heart rate percentages there. So mesocycle 1, mesocycle 2, upper body, lower body, core, so on and so forth. Moves on that way. There's just the routine, some exercise technique. The video link for my 4 movements for my compound is right here. The upper body and lower body compound movements in the video are neutral or dumbbell neutral bench press and dumbbell shrugs, barbell back squat, and dumbbell step ups. Here's a little bit of information why I went with these movements. The dumbbells, keeping his shoulders more in a neutral position will help eliminate any sort of shoulder dysfunction, and the shrug will tend to pull his shoulders, or shoulders tend to be rounded, pulled forward. So with the shrugs, we're going to work on posture, standing upright, and working that shoulder pattern north and south to really help keep those shoulders more in a neutral position. With the back squats, working on his feet tend to flare out, so working more on foot angle, creating better torque within the lower half. And he does have some minor disc herniation in his C5 to upper T, the thoracic region. So he just got doctor's approval to work more on the back squats, creating some compression there. So we're working that back into our routine. That was something that happened most recently within the past 3 to 4 weeks. So the step-ups are working on more of his unilateral balance. He does tend to be a little wobbly on a lot of his lunges and steps, so working more on that grasp there. Application, I really like the Gray Cook's application of move well, move often. That's his motto, and it's a great tagline. If you move well, if you move often, even if you reverse this, if you move often, you should be able to move well. So making the right corrections will help make you do both. Movement quality is better than movement quantity. I think being able to move better is being able to just move. Understanding why quality is better than quantity. Listening is sometimes better than seeing. I mean, you might be able to see great movement, so your client might be able to you see them doing great movement, the patterns are great, but they might not feel what you're seeing. So making sure that you're listening to what they're saying versus just what you're seeing. Finally, with my faith integration, kind of just here are my three Bible verses. This one is Jesus went around to all the towns and villages, teaching in their synagogues, proclaiming the gospel of the kingdom and curing every disease and illness. And I said a health and fitness professional can help eliminate obesity and other metabolic diseases that a client can be prone to. And then here are just the other 2 that are going on, and being able to help the clients understand how important their health is and show they don't have to do it all by themselves, being their support system. Another way to integrate this 1 Corinthians 13:12 is guiding a client to fully understand and appreciate themselves in times of doubt and discouragement, seeing the true picture, being able to, they trust you, so you have to trust them, making sure that you can help them understand the importance of living a long and prosperous life through health and fitness. Here's my appendix. Like I mentioned, his scores through the FMS. The only one that's not on there is the shoulder mobility screen, the clearing test. And here are my references. Thank you, everyone. It was a great class. Learned a lot through this fitness and education course. Hope you all did. Best of luck to you, and God bless.